Theatre 3 is a state-of-the-art orthopaedic and general operating theatre with cutting-edge clean room technology and designated space for robotics. The theatre is fully integrated with the best available equipment. The risks of infection during surgery are further minimised, ensuring improved clinical outcomes.
My career in orthopaedics started as a medical student. I trained at Melbourne University, did my early training at St Vincent's Hospital, and then I took a year off. Was a medical officer for a trekking company in Nepal, and then landed in England, where I spent 8 years learning to do surgery and then orthopaedic surgery. I wrote my thesis in orthopaedics at Oxford University, and then was asked to come back to Adelaide and finish my training. After that, I went to Canada for another year working at the Hospital for Sick Kids doing orthopaedic surgery, and then came back and worked at the bone transplant unit at the Queen Elizabeth Hospital. All of my referrals now are for hip and knee surgery. I also practice a lot of complex hip and knee surgery, taking implants out that are failing and replacing them with new implants. In hip surgery, I do a lot of work with respect to hip preservation and hip arthroscopy, resurfacing younger hips that don't necessarily always require a total hip replacement, and then total hip replacement surgery for the older patient. In knee surgery, I started many years ago focusing on chondral grafting. I learned a lot about chondral grafting in my time in Canada, where we're using a layer of the bone called the periosteum to coat articular surfaces. Then we started culturing cells in the laboratory in Scandinavia, and now we're doing that sort of work here in Australia. I started doing a lot of consulting work for implant companies many years ago when I was in Oxford, and since then I've always been involved in research and development of products for implant companies. Most recently, I'm doing a lot of consulting work for Smith & Nephew with implant design, instrument design, and the use of the Cori robotic tool. The most thing I enjoy about my work is seeing my patients enjoying a full life after they've had their surgery. It's so good now to see some of my patients playing golf with their new knee, see them riding bikes with their new hip in. It's just very, very good to see them smiling, having a coffee with their mates. That's a very rewarding part of my work.
To find out more about Dr. Tony Spriggins, contact Western Hospital at 08 8159 1200.